Public Health Minister Dr. George Norton has said that he is saddened by the situation facing the mother of Jason Mars. The woman's 4-year-old son met his death at the Georgetown Public Hospital Corporation in late 2013. Minister Norton said that the information was not forthcoming during the investigation and the matter was delayed. He noted that it was unfortunate that the matter is now within the ambit of the law. Dr. Norton said he has known the mother of the 4-year-old for years and was very involved in the case, but said that the matter is now out of his hands.
Where I am now, I am not saying this is what I will do, but I'm saying that being a parent, being somebody involved, wanting to put a settlement to this situation, I would have preferred much more of a mediation, a kind of, you know, we're not saying that we want to pay her for her child's death or so on, you know, not at all. But I think it might have been a better situation than that because it could, you know, be drawn out in the court of law.
The public health minister said details of the findings for the case cannot be revealed because the matter is before the court. He also could not mention the fate of the physician.
I can't comment on the investigation, but I know for a fact that um, the investigation at the level of the administration was completed. But because it's in the level of the court, certain things you can't reveal right now. Um, for us to conclude that nothing has happened to the physician might not necessarily be accurate.
Mars was admitted as a patient at the GPHC after he accidentally fell and hit his chin on a 5-gallon bucket. He cut his tongue as a result. The child was at home with his maternal grandmother, Nancy Gittins, at their West Rheinfeldt residence. He was initially rushed to the East Penitence Health Center, where at the time efforts were made to stop the bleeding and assess the extent of the injury before referring him to the GPHC for further care. The child was administered at least two 25-milligram doses of anesthetic drug, which was intended to sedate him ahead of having the tongue sutured. The drug was, however, not sufficient, thereby forcing the attending doctor to refer him to theater, where the child's condition deteriorated. He was hospitalized for close to 1 week before dying in the hospital's intensive care unit. A post-mortem examination stated that Mars' cause of death was pulmonary embolism, a clot in the lung. For Prime News, Nicole Telford.